me in studio is my good friend Dr. Joe Congeni from Akron Children's Hospital. And, Joe, the word officially came down last weekend. I think we all had an inkling that this was going to be the story that Carlos Carrasco announced on social media, that he's been battling leukemia since it came down in the month of May. And you looked up some statistics and information for us.
Yeah, I mean, a lot of people might say, geez, what does something like leukemia have to do with sports medicine? And the fact is, when you, like us, when you are with a team, you take care of a team, anything medically can happen. So this year in the Akron area, there's 2 cases of high school athletes that had cancer. And so if you're taking care of, and from all indications, it seems they're beating it, the high school kids too. But so with leukemia, I mean, there's been so many changes. Leukemia is cancer of the blood cells. There's 3 different kinds of blood cells, right? White blood cells, red blood cells, and platelets. And the white blood cells start to crowd out the red blood cells and the platelets. And there's several different types of leukemias. But in the country, there's about 60,000 new cases a year of leukemia. There's a lot of new cases. It is male more than female. It's adults more than children. That's surprising. A lot of people think this is a childhood cancer. But it does affect you kids a lot, but it affects adults more than kids. But the big thing for us, too, is looking at the survival rates. A big thing for survival of if somebody's going to make it is really called a 5-year survival rate. That's what we look for in all the different cancers. And just to show the contrast, you remember a couple of years ago for the book I wrote in Cleveland, the heartbreak of Ernie Davis, the Elmira Express in 1963, he had leukemia. And that time in 1963, there was about a 14% 5-year survival rate. Ernie Davis died just a little over a year after he got leukemia. Now there's a 65% survival rate of all comers with leukemia. And in Carlos Carrasco's age range, it's actually 70%. So pretty good rates. We're doing a lot better 5-year survival rates than just 50 years ago when Ernie Davis had this. So, one of the things I wanted to mention also is the treatment. It's very variable. It depends so much on the type, but there's really 4 different things we do. Number 1 is still chemo. And gosh, chemo is just so rough from a side effects profile. Some types of leukemia don't need chemo. We don't know exactly what his treatment. We don't need to know that, but chemo is still a big part of treatment in some. Radiation is an important treatment in some. The new kid on the block is immunotherapy or biologic therapy, where it actually helps improve our immune system to fight off the cancer of its own. And some of the new immune drugs don't have a terrible side effect profile, but they're extremely effective. So we're excited about immunotherapy in the last 10 years.
Yeah.
And then also stem cell transplants, where we actually get down to the cellular level to change things. And stem cell transplants, a new kid on the block with. And so I just need to mention, I heard it coming in today, this is the Jimmy V week, the Jimmy V Cancer Research Week with the ESPYs on tonight. They now have raised $100 million in cancer research. So cancer research really does work. In 50 years, we've gone from 15 to 65% survival rates. And there may be a day that we see what Jimmy V talked about, that there be no more cancer, that we cure this thing overall. And in some cancers, we're getting pretty good. Others, not so good. But those are a few of the statistics. That's what Cookie's going through. That's why that meant so much last night when he was out there with his teammates and everything else. It really put everything in perspective, because, I mean, gosh, this is life or death. Cookie really believes that he's going to be back out there pitching, so we'll keep an eye on that. He thinks, and he's mentioned that he thinks that we've got it under control, which is really good news that he's speaking about.
Joe, I love what he is also doing, too, spending a lot of time at Cleveland Clinic with the kids and other folks that are battling leukemia.
Yeah,
I don't know if you saw that.
Yeah, I did. Boy, is that moving. That is so awesome. And to see a lot of athletes really giving back. They get a lot of criticisms. They make a lot of money. A lot of athletes visiting the children's hospitals. We get a lot of support at our children's hospital, too, by, VIPs and other people around our town come down, spend time with our kids. That's really moving with Cookie and the leukemic kids, too.
And you're exactly right. I remember it's probably 25 to 30 years ago, I think Tom Landry got leukemia. And it was almost thought of back then, when you heard the word leukemia, you thought of Death Notice.
Right.
Not so much today.
Right, 65-70%. Doesn't that sound good? And we've made some strides. And when Valvano got up there and gave that talk, hey, let's really get cancer on the run. And wow, it's happening. I mean, the numbers are really eye-opening.
Terrific. You wanted to bring up one other thing.
Yeah, I did. Jonathan Lucroy had a collision at the plate just before we broke for the All-Star game. Those happen, those types of collisions. They happen in soccer with the World Cup. They happen in football and other sports too, basketball. But with Lucroy, what it brought up, they talked about him having a broken nose and a concussion. I mean, there was no doubt when you saw the pictures of that, he was concussed as well. I was worried there at the beginning. It almost looked like whether he was jerking, almost kind of a seizure type. But remember that a lot of times athletes get other injuries, like a broken nose in his case, or a cut on the face, or poked in the eye, or even a shoulder separation like Ray Fosse many years ago. But they can get those and also have a concussion. So check them for a concussion as well. Many people focus only on the shoulder and totally miss that the way the kid got hit, it could be a concussion as well. So get them in to be seen. Many of those are a concussion plus another injury. A lot of times we want to put them in a box of just one injury. And so I see that a lot down at my place. Then 5 days later, 10 days later, the kids are showing all the signs of concussion, and nobody even thought about it initially because we're focused on the broken nose or the shoulder problem.
All right, good stuff this morning. Joe, thank you for the visit.
Yep, great. Have a great week. Enjoy this weather, guys.
You too. Dr. Joe Congeni, Akron Children's Hospital.